Hello, I'm Dr. Raman Narasimhan, a board-certified internist and internal medicine specialist working at Apollo Green Road, Chennai. Internal medicine deals with chronic complex conditions. So I'm the first point of contact when the patient either comes to the outpatient department or inpatient department to the ER with a medical illness. For instance, it may be sepsis, it may be chest pain, it may be abdominal pain, and that requires them to be admitted. So the emergency room doctor typically calls an internist or an internal medicine specialist like myself. And my job is to go there, assess the patient to see how sick they are, what is the immediate treatment that will save lives. And also, sometimes we determine that this does not require an admission. We might be able to manage this as an outpatient, and I continue to care for the patient outside of the hospital, including providing medications, or the patient might be sick for them to be admitted either in a ward or much sicker and belong in the ICU, wherein we manage the patient alongside with the critical care group as well. And the outcomes are obviously a successful and a healthy discharge of the patient back to their house. That is the best case scenario. Should the patient need continued care either from the ICU to the ward and then a subsequent discharge, or from the hospital out back home and may have certain needs like, it may be something very simple like a nurse continuing to give them antibiotics or even a meal planning or setting up follow-up blood test. So we take care of all of that until they're completely free of any medical needs at all. We also set up for follow-ups in the outpatient departments in a timely fashion. Things that can be handled slowly will be handled in a timely fashion after the discharge. So it's a complete 360-degree care for the patient, whether it be a post-discharge, medications by the nurses to go to their house and give it, or dietary planning, lab tests to be arranged, follow-up either over a video call if they're unable to come in, or in person so we're able to examine them. Sometimes we have our own team of doctors who go to the house as my eyes and ears and get back to me on that. So we completely take care of the patient till and beyond the discharge. So I, Dr. Raman Narasimhan, as an internal medicine specialist, would offer and educate you and urge you to choose us as a first point of contact for all your medical needs, whether it be inpatient or outpatient setting. And we're here to help you at Apollo Hospitals and hold your hand and get you on your road to wellness from the beginning and beyond for years to come. So choose us as your first point of contact. Thank you.